we have to look at what are the ways in which exercises can be performed in the water. There are certain precautions we need to take. Before you go to a session, it's important that the aquatic therapist does a screening for you. The screening is essential to rule out any possible contraindications or any precautions that needs to be taken before taking aquatic therapy. The other important factor is wearing the right attire or a proper swimming costume, because if you wear anything, any cloth that is loose fitting, you already know because of the water the clothes are going to come up and it's going to put you in an uncomfortable position to do your exercises. Once the screening is done, you need to take a shower so that you take away all the germs from your body and enter the water. Do the exercises and then you go back and take the shower again to wash off all the chemicals. This is at the outset the basic preliminary, or let's say the basic elements that we have to keep it in mind while we're taking an aquatic therapy session.
While designing activities, certain points have to be considered. I've just highlighted 4 or 5 components, and I think this can be elaborated. One is local and global. Local is the issues that are associated to a specific joint in which the problem persists. And global would be to address all other muscles and body structures that are surrounding it, or addressing the individual as a whole. When we look at local and global, we have to look at strength and endurance as the primary components, strength of the muscles that are present around the joint and endurance of the muscles around the joint. Along with it, we also need to look at general muscular strength of the individual as a whole and general cardiorespiratory endurance as a whole. So the global benefits have got a local effect. That is what we need to understand. Just developing strength and endurance alone is not enough. That has to be applied in a functional way through improving balance and neuromotor activities. So the exercises should be focused not only on improving strength and endurance, it also should be focusing on improving balance and neuromotor. There are certain general variables we keep into consideration, which could be age, the level of degenerative changes, the stage of arthritis, and the comorbidities. Certain individual variables would be that the person may have deformities, he may be obese, the gender of the individual, the personal physical fitness level, and the type of lifestyle a patient may have. After considering all these factors, we decide the type of exercises that needs to be done. Whenever we are doing exercise in the water, there are certain ways to modify activities in water. We can use aquatic equipments. We can use the deeper end of the pool or the shallow end of the pool. We can change the velocity of the movement or increase the speed with which the resistance also increases. If I increase the surface area, there is increase in the frontal resistance, so the resistance also increases. But changing direction quickly within a short time, it creates a drag effect, and this produces a lot of resistance for movement. So we have different tools in which the activities within the water could be modified. When we look at strengthening, the strengthening could be done in shallow water, deep water. We can use water as a resistance, or we could use resistive equipments which are like aqua dumbbells and aqua gloves and some things which I'm going to show it to you in the further part of the video. The idea is to improve overall strength as well as local strength, and to generally bring about a good body tone so that the person feels confident in performing the exercises, also which will reflect upon his quality of life. Endurance can also be managed in shallow and deep, and the simple way of doing this would be to do aqua jogging, underwater treadmill exercises, underwater bicycle ergometer, and aqua aerobics. Typically we use heart rate as a parameter at the jugular pulse to measure and say what is the percentage or the intensity of the activity. At the same time, we can also use rate of perceived exertion, that is the ability of the patient to speak when he is performing the activity, to understand whether the activity is high intensity, low intensity, or moderate intensity. When we look at balance and neuromotor, it could be done with simple aquatic exercises. This requires a little bit creativity while designing the activities. We can also use games and aquatic sports, simple games or sports which could be used to improve balance and neuromotor coordination. Gentle plyometric, not very hard. Some asanas of yoga could be used, and ai chi is found to be very effective in improving balance and neuromotor coordination. I would like to show you a small video of different kinds of activities. Please have a look and see the various possibilities that are present for performing exercises in the pool. And you see different equipments also being used. The exercises go from simple to moderate to complex, or maybe more difficult ones. This can be chosen based upon the patient and the fitness level of the patient. The decision again is basically dependent on the clinical therapist to understand how well he can adapt the aquatic environment for a patient with osteoarthritis. I hope you enjoyed watching the exercises and maybe get some ideas about how you can incorporate some. Some exercises, always while doing these exercises, posture has to be really correct. Not all the postures in the video may be absolutely right. You need to give a lot of importance to posture. And do the exercises for a specific duration of time and listen to your body. This is very, very important for the patients to understand. I hope you enjoyed watching the exercises and maybe get some ideas about how you can incorporate some. Some exercises, always while doing these exercises, posture has to be really correct. Not all the postures in the video may be absolutely right. You need to give a lot of importance to posture. And do the exercises for a specific duration of time and listen to your body. This is very, very important for the patients to understand. To conclude, I would say water is a very safe environment for people with osteoarthritis. Reducing joint impact forces, it offers a great degree of freedom of movement, reduction in pain and improved mobility. To experience this, You have to get down in water and feel the difference in your exercises.
Thank you very much for listening to this small clipping of aquatic therapy in osteoarthritis. I hope it gives a very brief idea about how aquatic therapy could be used for patients with osteoarthritis. This was a simple take on the benefits of aquatic therapy for osteoarthritis. Hope you all have a good year ahead. Thank you for watching and listening patiently. It's Prashanth signing off. Thank you.